So what do we do when we're doing a brow lift? We're not cutting any of these muscles, but we can reposition the brows. Oftentimes, patients who have very deep lines here in the forehead are overusing this muscle, the frontalis muscle, because it's the only one lifting it up. So if I can take that brow and lift it into the position you're trying to hold it in with that muscle all day long, now we can have your brow in a happy position where you're not using that muscle as much and is less tension on the brows, and you can have those creases diminish just because you're not using the muscle as much. And that's the power of an endoscopic style 4-point brow lift that I do. What we do is we make little incisions, just access incisions, behind the hairline here and here, here and here, and we go and we release the eyebrow for everything that's pulling it down. When we do that, the brow naturally wants to lift into its better position. We also weaken the attachments that are pulling that eyebrow down on the bone. And then that, again, brow lifts up into a natural position that is elevated, where you don't have to use that muscle anymore to keep lifting it. And we just secure that brow in that position. We're not actively cranking on the brow because that won't work. We're just releasing it passively, letting it lift and securing it in that new position. And when we do that, we now have the brow in a better position. You don't have to use this muscle as much. There'll be less creases throughout, and you'll look less tense, brighter, happier. That's the whole point of a brow lift. It's not to lift the brows as much as you can. It's to have a brighter, happier look.